Prrs stands for porcine reproductive and respiratory syndrome. And this is one of the most important diseases worldwide in the pig industry. And it represents a huge economic impact in countries where pig production is relevant, of course with the exception of Brazil, which is negative to Prrs. But beyond that, Prrs is a huge problem worldwide, and we have been dealing with this disease for many years. It is caused by a RNA virus, which is very difficult to control because their own characteristics. It causes a long-term viremia, is highly contagious, spread very slowly, and it has a particular epidemiology feature that makes this virus very difficult to control and eliminate, which is persistent. So we know that this virus can persist for more than 200 days in pigs, and that leads to the creation of subpopulations in farms that perpetuate the circulation of this virus for many days and months. When this virus comes into a farm and is circulating, causes reproductive failure, abortions, mummies, some mortality, and also respiratory clinical signs in growing pigs. But what is important to mention is that the severity of those clinical signs varies because also is influenced by the size of the farm, the immunological status of the population, the virulence of the strain. So there's many factors that will impact the severity of those clinical signs. What is constant is the economic impact of this disease. We know also that there's two species for these viruses, Prrs 1 and Prrs 2. Previously, we called these as genotypes 1 and 2, but based on a new classification now, we consider as a two species, and we call Prrs 1 and 2. And the distribution of these viruses is global, but with some differences in prevalence. For example, in North America, Prrs 2 is more prevalent. In Europe, Prrs 1 is more prevalent with some subtypes 1 and 2 and 3. And here in Asia, we have both Prrs 1 and Prrs 2, but we know that Prrs 2 is more relevant in terms of virulence and circulation and incidence. And of course, the focus on controlling Prrs in Asia, we know that should be around Prrs 2. Also, we have classification on Prrs 2 that we call lineages, but this classification is used for epidemiology reasons, right? In order to identify if I have a new virus, a resident virus, but also we know that this classification is not related to cross protection or virulence around these viruses as well.